The following is a study from Spain and the USA about melatonin and COVID-19. It was published in May 15, 2020. In all fairness, it was done before COVID-19 vaccines became available on a big scale. Therapeutic algorithm for use of melatonin in patients with COVID-19. In this publication there were quite a number of international health departments involved, also from the USA. We show you the text from the publication as it is. A link to the entire study you will find in the description below and also at the end of the video. Melatonin is synthesized from tryptophan in the pineal gland and by almost all the organs of the body, since its production is associated with mitochondria. It is noteworthy that high levels of melatonin play positive roles in health and aging. Melatonin, a well-known chronobiotic, is also a promising adjunctive drug for viral infections due to its anti-inflammatory, anti-apoptotic, immunomodulatory, and powerful antioxidant properties. Herein, we review the current evidence for a role of melatonin as a COVID-19 treatment. Since the clinical data is very limited, we propose the use of melatonin in patients with COVID-19 to reduce morbidity and mortality. COVID-19 infection may attack the melatonin synthetic pathway, resulting in reduced melatonin levels at a time when melatonin is most needed. The uncontrolled innate immune response promotes a massive inflammatory reaction and causes irreversible tissue damage and mortality. Melatonin is a potent antioxidant and immune regulator that not only suppresses oxidative stress but also controls the innate immune response and promotes the adaptive immune response. The pineal gland produces and maintains the concentration of melatonin in the blood. The melatonin synthesized in the pineal gland is 5% of the total melatonin produced. The melatonin produced in the mitochondria is not discharged into the circulation, but is used by the cells that produce it. If patients do not generate sufficient amounts of melatonin, their health status is likely compromised. Viruses, including Ebola, dengue, encephalomyocarditis, Venezuelan equine encephalitis, rabid hemorrhagic disease, human papilloma, and inter alia, have demonstrated the success of melatonin in protecting against viral infections. There is no evidence that melatonin is virucidal, but rather it reduces the severity of these infections. Melatonin's beneficial effects derive from its anti-inflammatory properties, free radical scavenging activity, and immunomodulatory functions. The cytokine storm leads to acute cardiac injury, acute respiratory distress syndrome, and infection, leading to generalized sepsis and multi-system failure, which may lead to death. Thus, preventing the cytokine storm may be key for the treatment of COVID-19 infected patients. Since there is a lack of effective therapies and immunological treatments may be insufficient, melatonin, owing to its multiple actions as summarized by Zhang et al., may have beneficial effects in preventing or attenuating the cytokine storm and reducing morbidity and mortality from this disease. A relationship between melatonin and aging has been suggested, due to a decrease in the concentration of nocturnal melatonin levels in the elderly. It has been hypothesized that melatonin can prolong life. The relationship of melatonin with aging involves three potential mechanisms. First, melatonin is a key molecule in regular circadian rhythms. Second, melatonin prevents cardiolipin peroxidation and regulates the synthesis of mitochondrial proteins. Finally, melatonin secreted by leukocytes exerts a powerful immunomodulatory function. Wu and colleagues have recently shown that advanced age is a poor prognostic factor in patients with COVID-19. This is due to the fact that in the elderly their immune response and physiological functions are decreased as a result of age, therefore, they are more likely to develop severe pneumonia due to COVID-19. Recent studies have shown that high levels of melatonin in the blood play a positive role in health and aging. These findings support a rationale for melatonin use in elderly suffering with COVID-19. Obesity is a risk factor for cardiovascular disease. In different studies, melatonin has been shown to have anti-obesity effects. Taking melatonin reduces intra-abdominal visceral fat deposition and body weight. Its anti-obesogenic effects are believed to be due to two processes. regulation of energy reserves and a relationship with the physiological processes of wakefulness/sleep rhythm. Diabetes is a risk factor for the development of cardiovascular diseases. Several studies have shown a functional interaction between insulin and melatonin, showing that diabetic subjects have a lower concentration of melatonin. Furthermore, decreased blood melatonin levels have been documented in patients with insulin resistance or glucose intolerance. The results of several studies suggest that low melatonin production is associated with an increased risk of cardiovascular disease. Furthermore, it may be beneficial in people who are at high risk of contracting COVID-19 infection, local health workers, where preventive treatment with melatonin would favor maximizing the immune response, along with anti-inflammatory and antioxidant effects. A daily dose of roughly 40 mg or higher would not seem an inappropriate amount. Moreover, melatonin has been demonstrated to relieve many of the symptoms of other viral infections. Our research group has extensive experience in the use of melatonin in the context of cardiovascular physiology. Melatonin can be administered at a total dose of at least 120 to 1000 mg/kg/subject weight and intravenously with a high safety profile. An aggressive approach is required to prevent coronavirus disease progression and mechanical ventilation. Nordland and Lerner published a report years ago in which he gave humans 1 gram of melatonin daily for a month with no untoward effect. Melatonin has a large safety margin without serious adverse effects. Our doses are based in an article recently published by Ramos et al. The authors demonstrated that when we extrapolated effective animal doses to human for a 70 kg adult, the results ranged from 19 to 1,527 mg per day. As there is no time or clinical trials to test the efficacy of melatonin at different concentrations, we suggest the use of melatonin, 100 or 400 mg per day, as an adjunct, especially if no efficient direct antiviral treatment is available. Conclusion: the COVID-19 pandemic has infected hundreds of thousands and killed tens of thousands of individuals worldwide. Time is not a luxury that this crisis has. The high mortality is caused by the uncontrolled innate immune response and destructive inflammation. Melatonin is a molecule that negatively regulates the overreaction of the innate immune response and excess inflammation, promoting adaptive immune activity. These findings, together with those recently summarized by Anderson and Reiter and Zhang et al., support the use of melatonin in patients with COVID-19. We agree with the suggestion by those authors that melatonin should be given consideration for prophylactic use or treatment alone or in combination with other drugs, and propose a therapeutic algorithm for use in patients. Melatonin is readily available, can be easily synthesized in large quantities, is inexpensive, has a very high safety profile and can be easily self-administered. Melatonin is an absolute superhormone, or, as Dr. Ettinger says, there is nothing it cannot do. It has basically no side effects even in higher dosages and does not make you addicted. In the case of COVID-19 it was not needed as the scientists in the article recommended it, since vaccines have been developed. But in the earlier stages of the pandemic when no vaccines were available it was also used. You might want to check again the news reports about former President Trump's recovery from COVID-19. They always mentioned melatonin among other things. This content has the sole purpose of demonstrating the unique power of melatonin. Melatonin is present in every cell of your body and stimulates your mitochondria, the powerhouse of your cells. Do you know any other molecule that can do what melatonin is able to do? Let us know in the comment section below.